Okay, so I am not a brain scientist. I'm a fraud. I am not a brain scientist, but let me tell you this. I am passionate about gerontology. I met Priscilla at a Brain Health is Wealth conference in Detroit in May. I had a booth right next to her with some work I do in Detroit. And so what she asked me to come and talk about is sort of our work in Detroit. And I just want to say one thing. I don't know Muskegon. I'm not black. But I would say the work we do in Detroit has the possibility to be tailored. We can partner. We're excited. And I think when you hear how long we've been doing this work at Wayne State and in Detroit, it might be inspiring. So I hope that will be helpful. Next slide, please. I don't know if I'm running my own slides. Let me find out. Okay, perfect. So I thought I'll just start with who I am and what I do to promote healthy aging, and then I'll actually turn to you. Who are you, and what are you doing to promote healthy aging? I also love that I followed the last two speakers, Linda and Rodney, because they're all about health and the brain stuff, which I told you I'm not already, right? I'm about connections, so I love like the healthy to connections. We're going to talk about connections right now. All right, let's see if we have a slide. So anyway, my first slide is who I am, and I just wanted you to know, because I know Priscilla, and if you know Priscilla, you know Priscilla, but most people in the audience do not know me, except for Jason and Johnny and Robert. So my name is Tam. I went to Vanderbilt with a math major undergrad, and then I went to the University of Texas and did a master's in social work. So I'm a social worker. I worry about social connections. And then I did a PhD at Michigan in social work and anthropology. For my dissertation, I followed 81 older adults through the process of moving. So I think of my first area of research is thinking about aging and housing. And I always think if you're in a room of older adults, someone's thinking about their housing. Is it suitable? Can I afford it? Etc. So that's sort of the work I do. But a long time ago, before I went and became an academic, I was a social worker, just a social worker. And I worked at the Older Adult Services Department in the Republic of Singapore. And I planned I planned the parade for the country to celebrate the International Year of the Older Person. I don't know if Johnny knows this, and he's Singaporean American. So yes, we reserved the National Stadium in Singapore and had a tribute to sort of aging well. So I've been thinking about aging well for a long time, and then I came to Michigan. Next slide, please. I also wanted you to know, this is my family. My husband was dancing a little last night. I have two children. My son Ben, he's crazy for Chicago. He goes to Northwestern. I was about to say he's crazy, but I thought I should continue with that. But he's crazy for sports, and he's a senior there. My daughter is a 7th grade school teacher in Oakland, California, the most diverse city in America, and she's fighting the hard fight as a 7th grade public school teacher. So that's me. I'm also the training director of the Wayne State Institute of Gerontology, and so, last weekend I was with 4,500 other people at the Detroit Zoo for the Alzheimer's Walk with my trainees and everything. So I supervise anyone on Wayne State's campus going into aging research. They're probably in touch with me. So that's exciting as well. So those are my students, etc. And they're all becoming. So the person on the left with the stroller and her son Nathan, the tall guy, she interviewed for a job to be a professor on Friday. So we are trying really hard to get young people interested in different ways. She actually studies medication adherence, which is what happens when people take their meds or they stop. It's bad news, right? So again, when we put all this efforts into people coming up, the girls last night, the guys I brought all the way across the state, like we have to, because we have to build a pipeline, which is why I want to talk to Doug. Okay, next slide, please. Okay, I do a lot of scholarship in different ways, but this is one of the things I did early on when I followed the 81 people through the process of moving. I've written papers about carpet off-gassing, and flower collections and light bulb collections, the very details that really matter sometimes. I'm an anthropologist, so I think a little differently. I don't crunch numbers, in fact I leave it to the others, but I think about the importance of stories. So that's me. If you know anything about me, that's sort of the work I do. Next slide, please. So, I have other hats I wear at Wayne State, and one of the most proud hats I have is to be part of the Healthier Black Elders Center. So there's a center called the Michigan Center for Urban African American Aging Research. Big mouthful. Our community name is called Healthier Black Elders Center, and we think it's easier. People know us in the community. What's nice is it's a collaboration between the three big universities, Michigan, Michigan State, and Wayne State. So we're all together in this center, and there are 18 resource centers for minority aging research across the country. Only 3 have been funded since the program started in 1997, and we are one of the 3. So our, So our work it's in Detroit, but it's also, we have a second branch in Flint, so I guess we're a Detroit and Flint branch. We do community outreach every month. We are high touch. We give a lot of health education, and then if people want to, they can consider being part of a research registry where you're invited to studies. And so behind the scenes, next slide please. So we have over 1,000 research registry members right now, but I want you to know, everyone in this room who's 55 or older, you can be part of this registry. So maybe it'll take Muskegon a little while to build some projects. We will take you in Detroit if you want to be on our registry. It's an older African American registry. And here's the thing. We openly acknowledge the traumas harmed by researchers to persons of color. We talk about Tuskegee, we talk about Henrietta Lacks, we talk about all the other times that people have been harmed by research. And yet we think it's really important for persons of color to be at the table. So you can come and talk to me about it, you can sign up today, but I just want you to know, like, all research should be voluntary. We spend hours and hours just honing that message over and over. So it's about the ethics and trusting the researchers. So the people in Detroit, we had a big event on Thursday, they see me every month. So this is sort of the way we do the work. So we have these big community events called Lunch and Learns. You always get a free lunch afterwards as well. Next slide, please. And this is like the whole team. And so we have people at Michigan, Michigan State, etc. And so we're really passionate about this work. Next slide, please. And also, you don't have to go back, but there are 2 older adults who are employees too, which is really great. And so this is Jason. He came after we met at the basketball game in January. I said, if you want to learn about brain health, you need to come to Detroit and come to one of my programs. So he came on the train on May 8th, May 7th he came. And he came to the event, and all the older adults who we work with were sitting down. This is Aaron, who's also a student. I spent a lot of time trying to get people interested in aging research. Next slide, please. And so we also give paper newsletters, which I brought. I could only be spared 10. So that's why I don't know how many I can do, but I can definitely give you the PDF. And I wish, when it says all issues are posted on MICWAR website, you will click it and it says under construction, because we are very worried that the feds are going to take away our program. So it is under construction now. And you know what I'm talking about, right? Yes. We, in the minority aging research space, we've had grants cut, we've had them thrown back, we have them cut. We're on a big roller coaster this year. Next slide, please. Okay, and this is our registry. And again, let me know. I'll just talk to you individually if you're interested, but we would really appreciate it. Next slide, please. So, your famous Robert Turner, before he came to Muskegon, also, do know, I drove him to Muskegon. Our favorite vote, he came on Thursday to our Lunch and Learn. And so when I told him, oh, why don't you come to Detroit? He came Wednesday night. And so he could go, and he inspired so many people. They were very excited to meet him on Thursday in Detroit. So again, this work, I would just say, the work we do in Detroit and the way we do it, I invite anyone to come over. Our next one is October 29. Come. You can be my guest. We give away Subway box lunches at the end as well. Next slide, please. So I just wanted to also and I have about 5 more minutes, is that okay? I want to just talk about reframing aging. So there's a whole worry about ageism, and people not always seeing people as they age as like someone who's like taking from the community. So in a lot of my work, I'm trying to say, no, let's recognize when older adults are giving. they're giving, they're caregiving, they're caring for their grandkids, they're caregiving, they're working, they're volunteering in churches and other places. And so we have a very active sort of advisory board called our Community Advisory Board. And I'll just let you read like Henry's sort of response. He's 86, he lives in Florida, and he loves saying he has these opportunities to give. And so I think another way as you're developing programs is to think, how do you recognize the contributions of people of all ages as you're doing this work? Next slide, please. And then these days, not today, but these days, mostly I don't want to speak alone. So I'm mostly giving talks in partnership with a community advisory board member. So people are not just hearing from academics. And so a big motto of mine is to democratize research, that the ivory tower can't hold all the knowledge. So this is Joanne, she's been on our community advisory board for 20 years. And so we just spoke at WashU on Zoom a few months ago as well. Next slide, please. This was me in Washington because we've had to fight for science, as you know, right? And so what's really nice is of the 4 papers they chose to sort of highlight one I did. And I wrote that with at least 5 older adults as co-authors. And that's a very big deal for academics. And it's a very big deal to say, it's not just my voice that matters. So we're really excited about that. And also, we left that at probably 100 legislatures' offices as well. But it's been a big fight for science lately. Next slide. I just kind of wanted to end with this. So I'm switching from who I am, what we're doing in Detroit. And Priscilla said, well, what's something useful people can take with them? And this really follows what Linda Gorman was talking about with social health. This is a model of who's in your social convoy, or who's in your network. And it's done by researchers at Michigan, Tony Antonucci and Robert Kahn. Robert Turner and I just had dinner with Tony on Thursday, and I said, oh, I made a slide about your big model. This is what she told me to tell you. Just tell him I'm not dead yet. So I'm like, I can very much verify as of Thursday, Tony is well and alive, and she's an established researcher. And I don't know if you can see it, so I'm just going to read it, and then I'll conclude. Sorry. I would encourage everyone in this room, if we had time, we could take out a piece of paper. Sometime we could do it as an exercise. But think of you, the person, the center, and who is in your world. Because the thing about all this stuff, you can only get through it with more and more social connections. I think Linda's was saying that as well. It really does contribute to brain health. Social isolation is really bad for brain health and physical health. So I'm just going to read it out because I think the letters are kind of small. So you might have a partner. You might have people who stay in over time. And I heard this yesterday when I heard, like, I've known her since kindergarten, I've known all the flip-flop stories yesterday, right? Right? And then, who are your close friends? Who are your close family members? And then sometimes it changes. Let's all acknowledge. Sometimes you aren't besties with the person from the flip-flop days, right? And that's okay. And so think about things that are changing, like families and relatives and friends. Sometimes you switch jobs and you get different work friends, etc. So you have coworkers, neighbors. The distant family, you don't see them all the time, but you know they're out there. And if you needed them, you could pick up the phone, right? And then, think about who in your life can be a mentor or supervisor as well. So I'm just going to leave you with that. This is a really old model from 1980, but on the other hand, it's not that different than what we would encourage today. All the brain health researchers are also saying, look at your social health. We saw it. It was the number one S, the S, right, of SPEC. So anyway, I'll leave you with that. Come over and talk to me. Thank you so much for inviting me.